Merhabalar.
Hello. What is hydrocephalus disease we mentioned before? Now, let's talk about how to understand and diagnose hydrocephalus. We mentioned that obstructive hydrocephalus occurs mostly in newborns. In newborns, the skull bones are not yet fully fused. There are still spaces on the top of the head known as fontanel or soft spot. The skull bone is not yet hard. It has a relatively softer structure. Therefore, it is suitable for expansion. When the volume and pressure of the cerebrospinal fluid in the head increase, the baby's skull begins to enlarge. This is where head circumference comes in. The head circumference of a newborn baby is approximately 35 centimeters. Pediatricians regularly monitor the baby's head circumference during checkups and take notes. If there is an abnormal trend in the head circumference percentiles and curves, that is, if the head circumference is bigger than normal, the pediatrician will suspect hydrocephalus. In addition, the baby's fontanel is normally very soft and bends in when you press it. But in hydrocephalus disease, the fontanel becomes tense, like swollen and hard as a stone. From this situation, it can be understood that there is a progression towards hydrocephalus. We said that in hydrocephalus, the skull expands and the head enlarges. In addition, the skin of the head becomes thinner in parallel with this expansion, and the veins may become more visible. The baby's eyes may shift, and what we call upward gaze paralysis may occur. The baby's constant crying and constant restlessness are other factors that may make us suspicious concerning hydrocephalus. Now, technology has developed so much that we can easily diagnose hydrocephalus with ultrasonography, even in the womb. Treatment can be done even in the womb. Therefore, a baby with hydrocephalus can be diagnosed even before birth. After birth, it can be easily determined whether the brain cavities are large or not by observing the fontanelles, the skull cavity, and ultrasonography. But of course, the actual diagnosis is made through the imaging method we call tomography and magnetic resonance imaging, MRI. And in this imaging method, MRI, we can clearly see that the brain spaces are enlarged, curved, and inflated like a balloon if there is hydrocephalus. This is how hydrocephalus is diagnosed. We will explain the treatment options, especially in acute hydrocephalus, that is obstructive type hydrocephalus, and inform you in detail in the next videos. You can send us your examination requests on our website or through our communication channels in the description section of the video. This way we can get back to you in a short time. If you write to us about what other topics you would like to be informed about in the field of neurosurgery, we will gladly publish new videos on these topics. I wish you all healthy and beautiful days.